How is gout diagnosed with joint fluid? Imagine waking up with a sudden, intense pain in your big toe or another joint. It's often so sharp that even the lightest touch feels unbearable. That's a common sign of gout, a form of joint inflammation caused by crystals forming inside the joint. But how do doctors confirm it? One of the most reliable methods is analyzing the joint fluid. The process starts with a procedure called arthrocentesis. A healthcare professional carefully inserts a fine needle into the inflamed joint to withdraw some of the synovial fluid, which normally lubricates the joint. During inflammation, this fluid tends to increase in volume and may look cloudy or appear different in color. The collected fluid is then sent to a lab for detailed examination. First, the fluid is visually checked for its appearance. Doctors look at how much fluid there is, its color, clarity, and thickness. In gout, the fluid might be more abundant, less viscous, and cloudy because of the inflammation. Next, the fluid is examined under a polarized light microscope. This is where the key to diagnosis lies. The lab technician looks for needle-shaped crystals called monosodium urate crystals. These crystals are negatively birefringent, meaning they change the light in a specific way that helps identify them. Finding these crystals confirms gout. The analysis also includes counting white blood cells in the fluid. During a gout attack, the number of white blood cells is usually elevated, reflecting inflammation. However, these counts are generally lower than what's seen in bacterial joint infections. To rule out infection, the fluid may also undergo bacterial cultures and gram stain tests. If bacteria grow, it suggests an infection rather than gout. Sometimes, doctors measure uric acid levels in the joint fluid or compare the uric acid in the fluid to that in the blood. While these tests can support the diagnosis, they are not definitive on their own. The presence of monosodium urate crystals remains the gold standard for diagnosing gout. It's important to remember that serum uric acid levels can be normal during an attack, so relying solely on blood tests can be misleading. That's why analyzing joint fluid provides the most direct and accurate evidence. This method helps distinguish gout from other joint conditions like pseudogout, rheumatoid arthritis, or infections. In summary, diagnosing gout through joint fluid analysis involves carefully extracting fluid from the affected joint, examining it for characteristic crystals under a microscope, and ruling out other causes of joint inflammation. Always consult a healthcare professional for proper diagnosis and treatment, as each case can vary. This approach ensures an accurate diagnosis based on solid scientific evidence, helping guide effective management of the condition.